The CDC reports heart disease is the leading cause of death for women in the United States. It can affect women at any age. And during this Women's Heart Health Month, or American Heart Month, Dr. Tamala from the Carle Methodist Diagnostic Center is here to share some tips on how to prevent it. Thank you so much for being here, doctor.
Thank you.
So let's break it down for the beginners. First and foremost, what exactly is heart disease and how does it impact your body?
Okay, so the heart disease is the leading cause of death in men and women together in United States of America. In women, the heart disease presents a little different. Everyone thinks that heart disease is a man's problem, but it's a leading cause of death in women along more than all the cancers combined.
Wow.
So it's very important to actually, diagnose the disease before it actually hits hard on the body.
Yeah, so how does heart disease actually differ from something like maybe a heart attack?
So the heart disease can be in multiple types of symptoms. It's just not a heart attack. Heart attack is a blockage in the arteries, but heart disease can be heart failure, can be any problems with your pumping function of the heart, or your beats of the heart can be varied, or even younger patients can have heart disease when it comes to pregnant women who have preeclampsia or gestational diabetes are at risk of heart disease in future. So the heart disease starts pretty early, as in 30s rather than in 60s. So I always tell women is that if you have any concerning symptoms, get checked out and know your numbers.
What would those concerning symptoms be?
So heart disease presents very differently in women. You don't have that crushing chest pain like men do in women. They might be subtle symptoms like jaw pain, back pain, extreme tiredness, shortness of breath. And a lot of women brush it off as stress or anxiety, and they delay getting to the doctor, and that delay can be dangerous. So if you have any of those subtle signs and you're concerned about it, I would prefer get it checked.
Right. So what happens in that delay? So let's say you wait a while, how does heart disease develop?
So if imagine someone is having some subtle signs and they're too busy caring for someone else, and they say, oh, it might be anxiety, it might be gastritis, or it might be my acid reflux, let me take some Tums and just rest for a minute, and then days pass on like that, they keep ignoring it, and in that delay maybe the patient or the women might be having a heart attack. And time is muscle when it comes to the heart, so your muscle is probably dying from lack of blood flow. If you have a blocked artery and you don't get to the hospital in time, and the worst scenario is that you will have a heart attack or a cardiac arrest, and you might be got in an ambulance in an unconscious state.
Yeah, and like most life-threatening diseases, of course, it's always better to catch it early. So let's talk about the testing. What type of testing would someone ask for if they want to ensure that they're checking early for heart disease?
So at Carle Health Women Heart Clinic, we actually listen to women as a whole and for their problems. So if someone wants to get checked and they have some subtle signs and they're concerned about it, and they talk to their primary care physician, that's when the referral starts to our Carle Health Women Heart Clinic. And then we have wide variety of tests. We have advanced imaging tests like calcium scoring, coronary artery angiograms, cardiac MRI, stress tests, to even know if there is any problem that can start before they actually present in form of symptoms.
Yeah, okay, so let's talk about what these tests look like. As a woman, the older I got, once I found out what a mammogram was, I wanted to know, how do we take these tests? So what do they look like?
So the calcium scoring or a coronary CT angiogram is actually a CT scan where you go in a scanner and get scanned for your organ, and the organ that we are focusing on is the heart. In a calcium scoring, you actually know if there's any junk that is sitting inside the arteries, and that's what is responsible for blocking the arteries, and that's what is responsible for future heart attacks. And the same with the CT coronary angiograms, where you're actually looking inside the arteries to check for blockages or any junk that is sitting. And in that way, I always believe in prevention than cure. And if you know that there's a junk, you can actually try to prevent the further progression into a blockage, to prevent a heart attack, by taking medications and listening to your physician early.
Yeah. Is heart disease, does genetics play a role in it, or is it simply how well you take care of your body in regards to eating, maybe physical exercise or things like that?
I would say both. If there are some genetic conditions in the heart that run through the families, like like dilated cardiomyopathies or arrhythmias where the patients have weird heart rhythms, and some of the heart attacks also are genetics, but most commonly in majority of the population is how well you take care of yourself. The common risk factors are high blood pressure, diabetes, cholesterol, in early postmenopause in women where the estrogen levels are dropping, or pregnant patients who have preeclampsia or gestational diabetes are more prone for heart disease. So if you're controlling these risk factors, knowing your numbers and regularly visiting your doctors, you will be able to prevent majority of the heart diseases on time.
Okay, because we want that prevention, right? We really do. So what would you say is some of the most typical questions that you get from patients when it comes to this?
So majority of my patients, the age is ranging from 18 to 60, and a lot of them, when they want to come in, they say, I want to live longer, doc. What can I do now? How can I prevent something from happening? Or my dad died when he was 40s, or my mom had a heart attack and a stroke when she was 50 years old and I lost her too young and I don't want to be her. So for those patients, what I say is the change starts from today. So walking every day, maybe 30 minutes in a day. You don't have to go to the gym. Maybe just walking after dinner, walking to the park, walking your dog, simple things like that. I would say eating whole foods, reducing the processed foods in your diet, more fruits and vegetables and nuts, and then, knowing your numbers, the blood pressure, the cholesterol, your blood glucose, to see if you have any of the risk factors that you can prevent early. And then the last thing is relaxing, taking time for yourself, because I understand that all of us are busy taking care of someone else, but the priority is you.
Wow, a lot of great information, Dr. Tumala. Thank you so much for coming in and sharing.
Thank you so much for your time.
Of course.